I'm Dr. Woon Wing. I'm the internal medicine resident at Memorial Healthcare System in Pembrolizumab, Florida. Today, I will present a case of fulminant type 1 diabetes shortly after pembrolizumab treatment. So pembrolizumab is an immune checkpoint inhibitor, which can cause immune-related adverse effects, including endocrinopathy. One of them is type 1 diabetes mellitus, which is seen around 0.9% to 1.9% of the case. So what we have here is a 19 years old male who was recently diagnosed with nuclear protein tested carcinoma of the left floor of mouth. 14 days after his first pembrolizumab infusion, he suddenly developed classic symptoms of diabetes, including polydipsia, polyuria, and nausea. He continued to receive the second dose of pembrolizumab on day 20 and developed DKA on day 21. His workup revealed a very high plasma glucose of 856, as we've seen in our graph. Anion gap metabolic acidosis with elevated beta-hydroxybutyrate level. He is positive for GAD65 antibody. C-peptide is not detectable. His A1C is only 5.5%, suggesting his fulminant progression. So our patient only manifested immune checkpoint inhibitor related autoimmune diabetes mellitus, which is considered as a novel subtype of type 1 diabetes. Insulin antibody is positive around 50% in the subtype of type 1 diabetes compared to 90% in type 1 diabetes cases. Presentation is more fulminant with no honeymoon phase. The proposed mechanism is T cell mediated beta cell destruction with exposure to immune checkpoint inhibitor, breaking the tolerance to autoreactive T cell caused by the environmental exposure early in life. Unlike other immune checkpoint inhibitor-associated autoimmune diabetes that usually occur after 9 weeks of immune checkpoint inhibitor, our patient developed after 20 days of starting the treatment, which suggested that this is a rapid beta cell destruction. Clinical factor to predict the current and the severity of immune checkpoint inhibitor-associated autoimmune diabetes remain to be elucidated. So in conclusion, due to the life-threatening potential of DKA, clinicians should monitor patient receiving immune checkpoint inhibitor closely and should be aware of the symptoms of hyperglycemia for early intervention. Thank you for listening.